sister family. It's Dr. Tamara here. I'm at my kitchen table today. It's a beautiful sunny day outside and I just thought I'm in the house by myself. So I thought I'd come and introduce you to my lady who brings me so much joy. You probably can't see her very well. There she is. Isn't she gorgeous? My husband bought this for me for our wedding. She's very empowering. She doesn't have a name yet though, so I'm very keen. I named my tumor Karen. So if you guys have a name for my lady, what do you think suits her? Drop it into the comments. I'd love to hear about it. How are you guys on this beautiful sunny Wednesday, midweek hump? I am day one post my third cycle of chemo. So I'm almost halfway, just got to get over the next 2 weeks of side effects. I'm doing okay today, but I'm a bit amped up on steroids. I usually crash and burn by Friday, and then the next week after that's a bit horrendous. But Dr. Tim has me on a nice regime of medications, so I seem to be going okay. I don't know if you want the gory details. Thought I'd give you an update though. Got the cannula in first time. Unfortunately, the blood test took about 4. I'm obviously not, lost my train of thought. Good regime of medications. Yes, okay, so here's the interesting story. This is only hearsay. I'm not sure of the research, though I did have a nurse tell me yesterday that he had read a paper. So apparently, if you have hyperemesis or bad morning sickness in pregnancy, it's a fairly good indicator that you're probably going to have something similar during a chemo treatment. So I had really bad hyperemesis with both my kids all the way through. It wasn't fun, hence why I only have 2 children. So, so there you go. Isn't that interesting? Interesting. But so usually really bad gut cramping, quite a lot of bloating. Sounds a bit like IBS, doesn't it? Sort of profuse diarrhea. Some people get sort of mouth ulcers. I haven't yet. My skin's cleared up a lot this time around, which is really good. And just generalized fatigue and just washed out. So that has kind of been my journey in this experience. But honestly, every single cycle has been slightly different. And I think we're getting to know my body and the right medication regime so that I can just be a little bit more functional on a day-to-day basis. I am keeping up with my exercise, did 30 minutes on the treadmill this morning, and on the days that I don't really want to get out of bed, I just go and sit on the stationary bike in my PJs. So I'm really trying to do that. Keeping up my calories, weight maintenance can be a bit of an issue. I think I'm getting a little bit of steroid chubby cheeks, but as my husband said to me, this too shall pass. So I think I'm going to do okay. So if you've got questions, we are rapid firing for about the next 10-15 minutes. Remember, keep it short and sharp. Don't need to know your full medical history. Try and make it generic. I am sure there's somebody else out there who is wanting to know the same answers. So make sure that we're sort of having a good conversation and try and keep it clean, of course. So while I'm waiting for some questions, I thought I'd offer you this one. This is fascinating. Thank you, Rachel. Apparently, and I didn't know this, but apparently the word is out, not saying where, there's the suggestion that people have better quality eggs and therefore better pregnancy rates if you ovulate from the right ovary versus ovulating from the left. So my first thought was, oh, that's sort of rubbish. But of course, I have gone and done a really quick literature search just before I popped on here, so I'm not completely au fait, but I could find one article from 2020. Now, the first thought I go is we're now 2023, hasn't been replicated, so I'm not sure how much the scientific community actually values this. But it was looking at around about 100 cycles. Now, average age of these people were 31. So first and foremost, if you fall into that age kind of bracket, great. Does it necessarily apply to a 39-year-old? I don't know. So that's the first thing. Secondly, it was a retrospective study. So they just collected data off women that they had already seen in their clinic for other reasons, lots of different reasons. So really, when you're looking at making big statements like this, where it's going to induce some sort of change to therapeutic plan, then you want to make sure you're participating in a prospective, if not randomised controlled trial, where you sort of allocate people to treatment arms. Hard to do though. But not only that, these were single ovulation, right? So some of them were naturally fertile women who were just coming in for pregnancy monitoring. Some of them were women that were infertile and that were being treated. And a very small number, 90 odd, were going through natural cycle IVF. In other words, they were just monitoring their stimulation, watching them ovulate and just collecting that egg. And they measured their androgens and estrogens within the follicular fluid, and then they looked at pregnancy outcomes. And indeed, in these quite heterogeneous populations, they did find an increase in pregnancy rates for those who ovulated off the right side versus those who ovulated off the left. Could it just be coincidence? Well, it was significantly different using statistics. So I suppose you could argue that, all right, maybe it was for that particular population. But it doesn't account for people who undergo stimulation where we're collecting multiple eggs from each side. That study's never been done. So, and I would also beg the question, does it actually affect live birth rates? I mean, that's what you guys are interested in, right? Whether or not you go home with the baby. So you may get better implantation or pregnancy rates, but does it result in a live birth? That was not measured, nor were the miscarriage rates measured. So I don't know, take it with a grain of salt. Do you stimulate somebody and do IVF on them and collect 8 eggs, 10 eggs, note which side you're collecting them with, and even if the embryo doesn't look very good quality, are you going to transfer the one collected from the right side over the left? I don't think we've got enough data to be doing that, and certainly our most robust method of choosing an embryo at this point for the general population is to do morphological assessment at blastocyst stage, so day 5, day 6. That is still our best measure. And secondarily to that, going through some sort of invasive testing to test if it's chromosomally normal. And even some people are on the fence on that one. So I thought it was a really good, interesting question. Just don't know how biologically applicable it is to what we do, but it is certainly very interesting. But as I said, hasn't been replicated in 23 years, so not sure how relevant it is. Now, there have been some questions come through. Let's have a look. Michelle. Oh, thank you. Yes, I'm hoping you guys saw my Instagram reel. I came out yesterday. But yeah, I'm not minding the shave. I'm gonna lose a bit more. As you can see, I'm already losing it here, and there's a couple little sort of baldy patches, but I'm just gonna rock it for now. See how I go with it. We may be going the number 1 all over very soon. Thank you, my darling. Vivanya, hi, hope you're doing okay. Yes, I am. Curious about the IVF outcomes with bilateral hydrosalpinx. Oh, great question, my friend. Look, it is our recommendation that if you have obstructed, so nothing gets through, hydrosalpinges, we have a very serious talk with you about removing those, because we know that inflammatory fluid can reflux from the tube back into the uterus and create this really inflamed environment, and it will affect your pregnancy rates. Having bilateral hydrosalpinges is a really difficult conversation, because you then will lose any opportunity that you might have had for a spontaneous conception. So it's really incumbent on your fertility specialist, laparoscopic surgeon, having a good chat with you. Do we just take one and leave the other? Perhaps leave one if it's open, or do we take them both because you have decided to move on with IVF, you're a good candidate for IVF, and in fact we're going to get better results if we remove them. But yes, doing a salpingectomy, there's good evidence to do that. Bottle blonde, well, it's not me anymore. Can stress 2 deaths make you skip a period? Got PCOS? No, just turned 40. Oh, congratulations, my friend. That's a big milestone. Can stress to deaths? Well, that's that whole, I mean, if you've got PCOS, you may have irregular cycles anyway, right? So let's just make sure that we table that. Yes, chronic stress or even acute stress can cause your hypothalamic pituitary ovarian axis to shut down, because we know those stress hormones, adrenaline, noradrenaline, cortisol, and all the other neurotransmitters involved in that process can stop the signaling from the brain to the pituitary. And so you can get either absent periods or some irregularity. We do know that that can happen, but just be mindful of the fact if you've got a background of PCOS and you have the opportunity to miss a cycle, that may also be the cause. Joanne Henderson, if someone has a sperm count of less than 300,000, ooh, that's severely low. They say it only takes one, but yeah. Is it false hope? No, I have seen people with extremely low sperm counts conceive. However, your chances are exceptionally low, and you've got to weigh that up against how long you've been trying. I mean, obviously, if he's had a sperm count test, then you've probably been trying for a while and you've sought some assistance and some investigations. Is IUI going to be helpful to you? Probably not. You probably need IVF, and you may require ICSI treatment. So it's not holding on to false hope, but with more and more time, you're going to get more and more distressed by the fact that you're not conceiving. The other aspect is, why does he have a low sperm count? And I would really want to know that there's not something sinister going on. We know that men with testicular cancer can have low sperm counts, so it'd be really important he's got a testicular ultrasound, and some form of investigation has gone into why he has such a low sperm count. It could be rectified. So we are as obliged to look after his holistic reproductive health as we are to get you guys pregnant. So that's really important. Okay, this is great. GGM2P, does an early one-off HCG level in any way predict the risk of a miscarriage chance of an... That is a really difficult question to answer. There are so many factors around that. I don't know how far in your cycle you are. I don't know how long your cycles are. I don't know what the HCG level is. What was the relative progesterone or estrogen? Too difficult for me to answer. But to be honest, probably not that predictive. I'd be more interested in looking at your progesterone level than your HCG at an early stage. Anna Hitchix, is there a cause for low AMH? Healthy 25-year-old, AMH 8.5. First thing is I want to know you're not on the pill, because that will falsely suppress it. And I also want to know where your antral follicle count is. So that's done with ultrasound. You want to compare the two. Anything I could have done to preserve egg reserve? Freeze your eggs, my friend. If you really do, at 25, have a very low ovarian reserve, get those two biomarkers done, compare them, then I would be seriously talking to a fertility specialist about preserving your eggs. It's not a measure of your fertility. Remember that. Now, you may have a long-term partner. You may be ready to move forward and have a family. So, and you could fall pregnant overnight, even with the low AMH. But if you're looking to live a carefree life for a little bit longer, think about egg freezing. Meg DV, I'm nearly wrapping things up. My husband has called twice, so he's panicking. Can a chemical pregnancy early loss muck up a cycle for over a year? Not unless there's retained products. Early loss February 2022, cycles are over 50 days since. It's not a normal thing. Go and get seen by somebody to figure out why you have long cycles. So it's not normal. Oh, Hayley, how are you? Gorgeous. Emma, I've got 2 more questions, guys, and I'm going to wrap it up. Emma Green, can untreated bad hay fever or other allergies affect treatment outcome? No. Santina's Treasures, what are your thoughts on DNA sperm fragmentation testing? I do it. Some people don't. But I do think, again, it gives us an opportunity to talk to a bloke about perhaps some of his lifestyle practices, his alcohol intake, his smoking, his obesity. So even if the test comes back normal, I have then had the opportunity to say, hey, we're doing this test because we want to see how your lifestyle might be affecting your sperm as part of infertility. So I do it. Woo! Michelle, your progesterone's fine. What should your progesterone level be the week after FET? Well, I would like it, and I think most fertility specialists say the same thing. We like for it to sit around about 70. Is there any hard and fast rules on that? No. And certainly in spontaneous pregnancies, we see them a lot lower and we're kind of happy with it. Oh, I answered the next question. Joanne Henderson, this is the last question. Last one, guys. If needed to be on progesterone first pregnancy from 6 weeks until second trimester in first pregnancy, If need to be on progesterone first pregnancy from 6 weeks until second trimester in first pregnancy, would it be an automatic protocol next pregnancy? Well, it kind of makes sense. Like, you're going to be nervous if your specialist or your GP has not started you on progesterone. And it's very reasonable over that time where we're transitioning from the corpus luteum through to the placenta. It's very reasonable to have some progesterone support. You've just got to know when to start it. So, you really want to be starting it before the window of implantation. That's when I would be starting it if you're going to bother. So have a chat with your fertility specialist. Okay. Whew. That was a steroid run for me. Thank you, guys. Most of you hung around. Good to see you. I will be on next week. I just don't know what day, depending on how I'm feeling, but we will give you a heads up beforehand. And I'm hoping to generate some more reels. There's been some interesting developments, so I want to get some more reels out to you in the near future. Have a beautiful rest of your week. Look after yourselves. Look after each other. Bye.